right side and on the left side, lateral lung fields. Okay, and then if you want, you can go to the anterior lung field also, right? So now I am going to do this auscultation. I will be starting from the right side. Always remember that when you are auscultating the patient, you must have to be laterally to the patient. Okay, so I will be standing laterally, never like this or never from the front. Why? Because if I am standing from back, okay, I won't be able to see any changes on the facial expression of the patient, whether the patient is becoming drowsy or unconscious or whatever. Okay, and if I am standing on the front, I won't be able to compare it. So it is always better that the physician should stand laterally and then auscultate the posterior lung field, by which he can compare the movement of the stethoscope as well as he can see for the face, right? And it will be easy to shift from anterior to posterior lung fields, and it will also be easy for lateral lung fields, right? So let us start from right side. ઊંઘું શ્વાસ લો કાકા. Then move to the left side. Then move to the right side. Then left side. Then lower lobe. And then finish on the left side. Okay. This completes your posterior lung field auscultation. Then go to the lateral lung fields. And then left side. Okay. So that finishes your auscultation of posterior and lateral lung fields. Okay. The common types of additional respiratory sounds that can be auscultated are wheezes, crepitations and stridors. Wheezes, crepitations and stridors. Wheezes are usually produced as a result of obstruction in the small bronchioles. Obstruction of small bronchioles.